Good morning, good afternoon, good evening, and good night, wherever you are. Hello, Africa, Asia, Europe, Australasia, North America, South America, and Antarctica. Today's episode is dedicated very simply to stroke in the elderly. What is stroke? What is stroke in evolution? What is transient ischemic attacks? What is a completed stroke? And of course, the consequences of stroke. These are very big topics to cover in a small video like this today. But I would urge for you to read our blogs and also listen to our podcast episodes where we discuss these in detail. Stroke in the elderly is not uncommon. Most of the deaths that happen in our elderly are we will all die of something, right? Most of it's not normal death. It's a cardiovascular event like a stroke or a myocardial infarction or a heart attack, as we call. It could be cancer, respiratory, like COPD or asthma. Could be neurological, like Parkinson's and Alzheimer's and so on. Or could be others, addictions and mental health, depression, infections, and so on. But stroke in the elderly is important because the rate of stroke increases as the age of the elderly increases. And the most important factor for stroke in the elderly is hypertension. So checking blood pressure, keeping the blood pressure under control is very critical. And stroke in the elderly is also related to the past habits. So folks, if you are smoking, drinking, or doing drugs or whatnot, please consider that you might be a candidate getting stroke in the future. So the treatment for stroke in the elderly is also very variable because everybody is pretty unique and different. No one treatment works for everyone. But most importantly, remember the strokes can be minute or tiny without any real symptoms, not falling down from a stroke or losing consciousness or anything. These are called transient ischemic attacks. And there could be a full-blown stroke where the person's falling unconscious or actually dies. So stroke in the elderly is a very critical issue. And I hope you understand the important first things to do when you see somebody with a stroke. I'll give you a fine example. We had an elderly named June. I will not give out her last name. This was the year about 13 years ago or 14. And she was having a stroke, slurred speech, blurred vision, and whatnot. She picked up the phone and she called me. I happened to take the phone right in between two patients. I was shocked and I instantly instructed my staff to call 911. Pardon me. So the 911 went to her house and got her out in nick of time, so she was saved. But then, of course, June eventually succumbed to endometrial cancer. Wonderful person and mother and wife. So strokes are not uncommon. And I have people in my life, personal life and families who have also suffered from stroke. So remember, the stroke is an emergency and urgency. And please do not call your doctor's office or family or friends. Instead, go to the hospital, nearest hospital, and call the emergency line. Thank you so much, and I hope this helps. We'll talk about other things about stroke in the future episodes. Thank you so much for listening. Please like, share, subscribe. And definitely, I would love to read your comments on this. Thank you. Dr. Purnima from Mihygge. Take care.